is Madeline with Together SC. Ben and I are thrilled to be here with the folks from HopeHealth. HopeHealth has invited Together SC to help them build out partnerships so that they can better serve and connect with clients in their greater service area, building upon the good work they've already been doing in Florence. And that's why we have the Naomi Project here and Joyce Ford to talk to us about that experience. But first, before we get to that, Tiffany, I think you're going to introduce your team and help people get to know a little bit more about HopeHealth.
Yes, I'm going to unmute them. Can everyone hear me?
Yes.
Okay, good morning, everybody.
Good morning.
My name is Tiffany Strauss. I'm the Director of Community Relations at HopeHealth. I have a really fun job. And I am excited to be here with all of you this morning to talk about how we can do more things together and continue to serve the communities. Sally's going to introduce you to HopeHealth in just a moment, but I wanted to just quickly recap on how our first session went with Together SC last month, and then sort of tell you what our goals are for this morning. So about a month ago, we had our first Together SC HopeHealth partnership initiative call, and we were right here on Zoom, and it was really exciting. We were nervous, we weren't really sure what we were doing. Asked for grace. We're doing that again this morning. We're still navigating this to figure out the best way to use technology to build relationships. And so thank you for your patience and your grace as we work through that. And we just really appreciate, especially this close to the holidays, you guys taking the time to be here this morning. So during our last call, we were able to hear from Sally about the history of HopeHealth and where we are now. And you'll get to hear from her again in just a moment. And we also had Dr. Farah Hughes here. She is our Director of Behavioral Health Services. And she was able to talk to you, to the participants, about what we're doing in the world of behavioral health and how we are working to integrate behavioral health services into the primary care setting. That is extremely important to us and to federally qualified health centers. And there's a lot of discussion and movement on that area. And we've been able to make some really cool progress. And we're doing that in all of the areas of HopeHealth service area. And so if you want to hear more about that, I encourage you to go back and take a listen or watch of that link and hear from Dr. Hughes about all of the cool things that are happening around behavioral health at HopeHealth. So again, we're just here to introduce ourselves. We want to make sure that you learn about who we are as an organization and what we are doing to serve the communities that you all live in, and what our goals are to do more of that. And so one of the things is we thought it would just be really helpful for you to hear what we're doing outside of the exam room and talk about what community partnerships could mean as far as expansion and improving on those services. So the next really cool thing I get to do is introduce our Chief of Staff, Sally Backman, and she is going to talk to you about where HopeHealth has been, where we are now, and where we'd like to be. So I'm going to turn it over to Sally.
Thanks, Tiffany. Good morning, everyone. Like Tiffany said, thank you for joining us today. We know that it's a busy time of year, and we hope that you find this time valuable and informative for you. We wanted just to provide a little bit of history about HopeHealth and give you a window into the range of services that we provide in the counties in which we serve. We originated in 1997 as a grassroots volunteer organization serving people living with HIV. In 2005, we expanded our services into Aiken County. In 2006, we expanded into Orangeburg County. All three of the sites provided supportive services to people living with HIV. In 2007, we achieved our federally qualified healthcare center status. What that allowed us to do was to begin to provide services on the primary care and pediatric side. And our goal is to provide excellent services at an affordable price. We provide care to people who are insured and uninsured. and we make sure that finances are not a barrier to care. One of the goals that we have is to make sure that people know that they can come to us and not just receive primary care, but also supportive services like behavioral health, substance use disorder treatment, pain management, nutritional care, women's health, just a wide range. And we wanted to focus on the Orangeburg office today. They began to provide primary care in 2019. They share the primary care responsibilities with the Family Health Center. So that's one of our counties that shares space as FQHCs. In Orangeburg, we also provide the infectious disease services. So, gosh, I'm all over the place. This is my nerves talking, and I so apologize for that. In the Orangeburg office, we provide behavioral health services, access to nutrition care, primary care, and screening for HIV, for hepatitis C, and for STDs. We also depend highly on our partnerships that are already in place. We have active and healthy partnerships with our DAODAS agency, the McCord Center. We work closely with the Samaritan House, which is our homeless shelter. We have a good relationship with Orangeburg Area Mental Health Center. So we really try to make sure that we link patients to the care that they need if we're not able to do it. And we're hoping that through the partnerships that we can develop through you and the people who hopefully will hear our message at a later date, that they would be able to figure out how they can help us meet the needs of our patients that we're really not qualified to do. Our best area of focus is in primary care and infectious disease. So I'm going to turn it back to Tiffany, and she'll take us from there.
All right, thank you, Sally. The next person that I get to introduce is really one of my favorite people at HopeHealth. Sandra Clare works in our Diabetes and Nutrition Institute. She spends a lot of time with our patients and coaching on nutrition and wellness, is award-winning, and has a lot to offer for our community members as well as our patients. And she's going to share more about what she does to take care of our patients and community and what community partnerships mean to her. So Sandra?
Good morning.
Good morning.
One of the things that I focus mostly on is I do recruitment for our community classes. And in recruiting, it's always a challenge, because if people don't know you, a lot of times they're just not interested in being a part of whatever it is that you have to offer. We're here at HopeHealth and we have so many things to offer. I spend a lot of time making phone calls, trying to make connections, and trying to get them to trust me. If I get them to trust me, and then they'll go tell someone else, and this is how we build our program and we build a relationship. Our community classes, we focus mainly on nutrition and how to eat on a budget. A lot of the participants are seniors, our middle class people. Most of them are working during the day, but our seniors, some live alone, or maybe they don't have family members in this area. They come, they fellowship, and they enjoy getting together to learn tips to live and have a better life, healthy lifestyle. We focus on, they share ideas with each other about how to maybe prepare another meal a little more healthier. We focus on getting physical, being able to take care of yourself, doing what you can do to help yourself. Having a provider is absolutely wonderful, but our providers don't always have the time to maybe spend with them and giving them some tips, resources such as, I had a lady that she was having issues with her blood pressure. After talking to her, we realized she wasn't taking her medication at the same time of the day. She made that small change, and it made a big difference in how her blood pressures were. In our Walking with Ease class, that is a class where we focus on getting physical. It is designed for persons with arthritis, but we welcome everyone to come. One of the ladies that came in, she was with a walker, and I thought, So how does she intend to be able to work with us? And she said that her ultimate goal was at the end of the 6-week series, she wanted to be able to walk up and down the stairs. So as each group went out, we had some that walk maybe slower. We have our garden, a meditation garden, some stay in the garden and some walk around the campus. This particular lady, she focused each week on going up and down the stairs. And at the end of the 6 weeks, she was able to do it. Now, that may not be a big thing to you, but to me, that was a goal she set for herself and she accomplished it. She went out, she told her daughter, she came back, she texts me, she calls constantly saying, you know, when are you going to do another one? They're always interested in what we have to offer. We have a Cooking Matters class. That Cooking Matters class, we get together, we prepare healthy meals, and then at the end of the series, at the end of each class, they are given groceries to take home to prepare the same meals. We'd like to get out into the other areas, that's outside areas of Florence, and be able to offer these same things, because I hear it all the time, constantly. What else are you gonna do? I had a lady from down in the low country, she came to Florence and she said, I'm coming here because you don't have these classes in these areas. And then she also said to me, and you won't get into these areas until you're a part of the community. And I asked her, what did you mean? She says, our community, they don't know you. And so they're hesitant about allowing people to come in. This is where you guys can come in and help us. If you're already in the community, they're already comfortable with you, we can join forces and we can be able to make a difference in the life. We can offer them so much more and just be able to provide. I look at a lot of the participants as grandparents. I love working with seniors. I love working with the youth. This is what I do at work and in the community, at my church. You just get it's a passion for me. I get such a joy in being able to make a difference in people's lives. And a lot of times it's not what I do, it's maybe the encouragement, the motivation that you give to them to make them be able to want to come back and continue to doing things to take care of themselves. And, you know, sometimes they may have issues that they don't feel that they have the time to talk to their provider about, and they share these things with me. I don't have the answers, but I do know we have resources here. So I try to make that connection with them. I connect them with the person that can help them with whatever the issues are that they have. And, you know, it's a team. We all have to work together to be able to get these things rolling and take care of our community. And I'm just excited about what we do. I'm excited about what else we can do and how we can join forces with our community classes. We are partnered with DHEC. They come in and they help us do these classes. South Carolina Vocational Rehab, they refer people to this program. So these are partners that work with us. And we're just looking forward to having some others, have you guys join us and let us just make a difference in the world. We can't help everybody, but if we can help somebody, then I feel that we've made a difference. I always say, when you know better, you can do better. If you don't know, you can't do what you can do. So we're just hoping that you'll just join forces with us and maybe we can do some things together.
Excellent. Thank you. Thank you all. I really appreciate that. I think that's a good overview of the organization. Tiffany, did you want to introduce Joyce or would you like me to?
Oh, we might have to arm wrestle over that one, Madeline.
I know.
I'd love to just say a couple of things about Joyce, if that's okay.
Please.
I am so excited. So last time we were together in November for this, we were able to hear from Cecilia Meggs, who is another community partner of Hope House and of many of you at Lighthouse Ministries. And today we get to hear from Joyce Ford, and she is the executive director of the Naomi Project here in Florence. And she has probably been, I know, my longest partner as far as my 9.5 years at Hope Health, and has just provided so much to me as a partner at Hope Health. She has also been a wonderful mentor to me as a new person into the nonprofit community in the PD, and is definitely someone I call upon regularly for advice from the organization standpoint and for advice as a professional working in the nonprofit world. So I appreciate Joyce so much for all she does. You see her out serving in so many ways that we're just so fortunate to have her in our community. And so I'm super thankful to Joyce for being here today to share what this partnership means to her.
Good morning.
Good morning, Joyce.
Good morning. Thank you so much for allowing me to do this. And this is quite an honor for me. So know that I'm nervous, like Sally talked about, but still I have to get my point across. I was asked to speak about Hope Health and the impact that it had on the Naomi Project. The Naomi Project, for those who don't know, we are a 16-year-old grassroots nonprofit that transitions women who have been in domestic situations. We offer the women and their children 1 year to take back their lives. Along with support, we offer resources and transitional housing. In these 16 years, Hope Health has been a vital part of our process and one of our resources from the very beginning, 16 years ago. We first opened, Hope Health asked us, what can they do to help? They came to Naomi. They didn't ask me to come to them. They came to Naomi to talk to me about what we needed and the process. So when they asked me what was my greatest thing was to regain the health of the women. When women are in a domestic situation, they take care of everybody but themselves. Most women that come to Naomi come without health insurance and no money. After much discussion, we came up with a plan. Hope Health's solution was to offer a voucher system. We're talking about in 2006 now. We had a voucher system that gave hope that when they presented a voucher at Hope Health, they would allow the women to be treated. This was a win-win situation for us because we knew that if we get the women healthy, the children are also healthy. This system worked with our motto, empowering women to take back their lives. Most of the women before the abuse were take charge women. This is what Naomi wanted to find and motivate to come back again. Hope Health has allowed the Naomi Project to be a part of their grants that they submit. Their funding along with the community contributions has helped our program running and our doors open. Whenever there was information that we needed, Hope Health came to our rescue by inviting the women of Naomi to attend classes they provided and give much needed support. One part of our program consists of 3 to 4 times a week. We have groups that discuss topics pertaining to domestic abuse, health, and wellness. We also plan fun things like spa day and cooking class. We bring in men and women from the community to discuss these topics. Hope Health gave us an opportunity to have somebody weekly from their organization to come to Naomi and participate in our sessions. And once Hope Health came to do a cooking class, so we can get back into that again with the lady who was just talking, okay? We have women who are gravely ill and needed attention as soon as possible. When we call Hope Health, maybe not the first time, but the second time, they respond. They show their partnership, that their partnership works. Let me tell you a story about one thing. There was a client in the hospital and she was not a patient of Hope Health, but they didn't care. They helped arrange for transportation to the hospital. And once she was released, they asked her to become a patient of Hope Health, and that she is still now. Now let's talk about Hope Health in the community. They have become a major leader within South Carolina in the healthcare profession. I consider Hope Health a grassroots, just like I am. And most of the events in the community, we all show up. The southeastern part of the state of South Carolina is so poor, and the resources are scarce and workers are few. With Hope Health willingness to go in these areas and bring much needed service, this shows that they have a commitment to the community, the state, a partnership, and also fighting domestic abuse, which I am a part of. All these areas are an essential display of Hope Health's foundation and reputation. Anyone who hears the two words Hope Health, they are immediately aware of the familiar identity. Everyone knows these two words stand for stability, strength, innovation, and awareness. Their display of service and reputation illustrates the people's trust in their medical services. Being a part of and a partner of Hope Health was the best investment Naomi has made. Thank you for allowing me to say what I said, and I believe everything I said.
And thank you for saying it so well, Joyce. Thank you for taking the time to clearly prepare and think about it. And I think that kind of partner endorsement is one of the reasons this program is going to succeed. It's one of the reasons Together SC was willing to come in and help identify new partners. And because when after Tiffany and I talked, I said, well, let me talk to Cecilia and Joyce and get a sense of it. And in those two conversations, what they said about the partnership with Hope Health clearly convinced me that there were so many other groups that would benefit from that partnership. And that's what we're aiming to do with this program, is help them identify. So this really is intended to be a two-way partnership. Initially, we were going to design the partnership agreement sort of based on what was being done with the Naomi Project and the Lighthouse Ministries. And then the more Tiffany and I talked about it, the more we thought, let's use our in-person meetings to design those partnerships. Let's really ask those we want to partner with what that partnership should look like. And so the next step on this journey is to gather in person. We'd like to do it in Orangeburg, and we'd like to do it in Lake City. We have January dates, but I am a little concerned we might need to push out a little bit given what's happening with COVID. So Tiffany and I will confirm those dates. We may push them to February just to give it time for COVID to drop down a little bit. But the goal will be that anyone that's been on these calls and others will be invited to attend one of those two meetings. And at those two meetings, we're looking to do two things. As I said, we're looking to get input and design what the partnership will look like. We're also looking to use that time together to really look at the issues in that specific geography that are impacting the social determinants of health. And there are a number of you on this call that actually run philanthropic groups or statewide agencies, statewide collaboratives. And I would invite you to bring your expertise to those meetings as well, because I think that's a chance for us not only to better understand the region so that Hope Health can work with the partners they want to work with, but it's a chance for Together SC to better understand those regions, for the nonprofits in the region to better understand and to share with one another, and for those also working with other groups to better understand the regions. So that will be the next step. And then after that, we will be in March. And I hope you all know that March is when the Together SC Summit is happening, March 9th through 11th in Spartanburg. And Hope Health has said, we think a great way to kick off this partnership is to invite those we choose to partner with and who choose to partner with us to attend the summit. So they will be offering scholarships to those after our January, February meetings, to those with whom the partnerships are are solidified to attend the summit. And then in April, we have a series of open houses for some of their local facilities, and we'll really kick off the partnership and how that will work. So that's sort of an overview of next steps. Hopefully you've gotten a sense from Joyce as to what the benefits could be for your organization in participating. But let's open it up for questions so that you can better understand what we're aiming to achieve and whether it's a good fit for your organization. And if you haven't already put your organization name, your name and the geography you serve and the purpose in the chat box, please do that. We will be using that. And if you weren't registered for some reason, add your email. But we will be using that to plan the group, get the gatherings for the next group. So let's start. I'm not really seeing any questions in the chat box yet.
Can I have a question?
Yes, sir. Can you identify yourself, please?
Yep. Yes, I'm Pastor Ulysses Sullivan of El Dorado Community Benefits and True Divine out of Orangeburg, South Carolina, a part of Singleton Health Center. We serve the PD area as well as the Low Country, and we provide healthcare assistance for seniors. Also, we work with our youth in what we call educational enrichment, is helping them with grade level skills, and also providing them with life skills as well to be productive citizens. In our program, we've already partnered with you with the healthcare piece with United Healthcare, where we had partnered in assisting those different locations such as King Street, Greeleyville, and Timminsville, and providing our services there to assist those patients to get extra help with their healthcare benefits. It was very successful because of COVID. We were not been able to go back in yet, but we're hopefully that partnership will be able to get back in those locations. I know Timminsville has addressed the opportunity. Hopefully it can come back. But my question is, in our area that we already established, we like to know how do we collaborate with the different Naomi projects, the Lighthouse, and the HopeHealth Recruit I've heard speak on programs. How do we get together on almost like a forum or either a workshop, and where we can come in and do these for the community? We've been very successful. I'm not sure if you know House Representative Pat Hennigan of Marlboro County, which I reside at. We have a program called the Coordinating Council. What the Coordinating Council does, we get together on a monthly basis. Now we're on Zoom, but it's the second Friday of each month. We have each organization to speak on what their events are, what they have coming up, and it gives the listening agencies to have an opportunity to join in with workshops. And it's been very successful for us in our area. And I would like to know and question, is that able to happen with a collaboration forum where we can get together and discuss our different events that are coming up, and we can partner together? I feel that there's no doubt it's been very successful in our area. And I think that would definitely be a big component from what you're trying to do. Is that any way possible that could happen?
Tiffany, what do you guys think? That's a good idea. Seems.
Yeah, I think I wanted to also preface, and I did this last time, and say I want to make sure everyone understands that we are not trying to recreate any wheels. So we definitely know that there are collaborative councils out there, coordinating councils that exist in these areas that we aren't well enough plugged into yet. And so I had some great discussion with the Office of Rural Health a couple of weeks ago about plugging into some things. So know that that we aren't trying to start something fresh that's already running well in some of these areas. But I am not sure what the status of the coordinating councils are in the Florence area right now. I do know there's something going on in Williamsburg that would be a potential plug-in there. I don't know if FC3 or the coordinating councils in the Florence area are running now, but I would encourage you maybe to look at these in-person meetings that Madeline and her team are putting together for the spring to come and talk in person with more of the community partners about how we could get something like that going. I think that's the best place to be right to
Right. I agree.
best
Because
suggestion.
it's already established. Yeah.
Yeah.
Gotcha. Thank you.
Yeah, I think what Tiffany's saying is if some kind of coordination among the partners that Hope Health is working with is an opportunity that doesn't duplicate what others are doing, maybe because it would be
Right.
multi-county instead of single county, that could be part of the programming. But what we want to do is first understand everything that's already happening in each community. So
Yes.
the idea of reaching out to the coordinating councils is a good one. And so since you're not on the Zoom call, did you register for the call so we make sure we have your name and email on the list? If not, if you could
I
just.
was registered online, but I'm not able to get on my computer in order that I had to go in through the phone. That's why I wasn't able to see.
So when we send out a follow-up to this call, you should get that, and we'll have your name and everything on that. Excellent.
Okay.
Let's see. I see Jen from the Low Country Food Bank would love to chat more about the food health program and how we could potentially work with your King Street location on securities. We have a number of the food folks here, and we're very appreciative of your being on the call because, in fact, the Harvest Hope folks have already partnered some with Hope Health. And so is there any specific question, Jen, or are you just saying that you're very interested in the work?
Just very interested. We have just recently launched our Food for Health program this past year. We're working with federally qualified health clinics in Hampton County, as well as Charleston and Berkeley County. We do not, Orangeburg is not one of our service areas, so it would just need to be limited to the Williamsburg location, but I think there's a really incredible opportunity there for food insecurity screening, the nutrition education that we do through Cooking Matters and through SNAP education, but as well as making sure that your providers are linked to our incredible pantries in the area and just all of that. So please feel free to reach out. I'd love to talk more.
That's awesome, Jen. I would love to encourage a conversation that involves Sandra. Especially about Williamsburg County. We, just for those of you who don't know, we now have 3 offices in Williamsburg County. I'm so excited. King Street has been there and was the first, and then we were able to reopen a practice that Black River Healthcare ran some time ago. How long has that been, Sally? In 2013, or shortly after, we opened the office in Greeleyville, which is, by the way, one of my favorite towns in the entire state. If you haven't been there, it's lovely. And now we just a week or 2 ago opened our office in Hemingway. And so we know there's a lot of work to be done in Williamsburg County, and we are really committed to do so. I would say, generally speaking, Williamsburg County, as far as partnerships go, that's a big interest for us. We have not done as good of a job as we should have in getting plugged in the community there. And I had a great conversation with Andrew from the Office of Rural Health a couple of weeks ago about that. And we are really excited moving forward. So Jen, I look forward to talking to you.
It looks like we have a couple of Williamsburg County groups on here.
Yay!
First Steps from Williamsburg is here. Who else did I see from Williamsburg? Courtney Food Share. You guys are working in Williamsburg. If you didn't mention whether you're working in Williamsburg and you do, please go back and add that so that we'll have a record of that. Carla, I see that you're on representing not only the Art Fields Food Foundation. I wanted to say hi. I think you guys have offered to host our in-person gathering.
That is correct.
Yeah.
Yes.
So you want to tell folks a little bit about your work and where you are? And
Yeah, I'm wearing two hats today. I represent Dramatic Coffee Beans, which is a youth development organization. We address the social dilemmas that young people face in today's society. Right now, we have a partnership with Hope Health and DHEC through the PrEP grant that we received, in which we've been able to increase awareness of the local health center that's based on our high school campus in Lake City that we're excited about. So we've been able to work through that a lot. We just performed at HIV AIDS Walk, which if you were not there, you better be there next year because it was really good. And then I serve as a consultant with the Darla Moore Foundation and Lake City Art Fields Collective, and we do a big art events each year. And we're looking at expanding that throughout the year and providing more services community-based wise. So those are the two hats. We're really excited and we look forward to having the meeting in Lake City.
Yes.
Thank you for
Yeah.
hosting. I'm looking forward.
Dramatic Coffee Beans is so awesome. Carla, do you all have a YouTube channel?
I'll tell you what, no, we don't. And it's so funny because one of our goals for this upcoming year is to showcase our performance side more. If you go to our Facebook and our Instagram, you see the kids, you see the meetings, but you don't see the arts. And so that is one area that we're really getting ready to kick up. So you'll be able to see it more. So maybe we will consider a YouTube station. I have to be honest, I'm not that techie person. So I'll leave that to my marketing and PR person.
Yeah, absolutely.
But we are getting ready to kick that up so people can see those skits on a regular basis and the kids have that opportunity to showcase.
They are incredible. They have performed at multiple AIDS walks in the last, over the last several years, and definitely make a big impact on our participants. And we really, really appreciate their participation. Even when they don't have a lot of notice, they still pull through for us, and we appreciate that so much. Carla, actually, if you don't mind, Madeline, Carla actually reminded me of something. I brought this up on the last call, and I just feel very passionate about it, and I want to make sure that I say it to you all too. One of my big heart projects right now is young adults. And we are seeing over and over and over, especially in the PD area and the counties that you all live and work in, that our young adults are not taking care of themselves. They're not getting into healthcare. And we are seeing some pretty scary data in regards to the well-being of our young people. And so we are talking a lot about that, and I would really love to talk with some of you all about that as well. Just to name a few things, I was speaking with a nurse practitioner who sees a lot of our young adults here. And when I say that, I mean like ages 18 to 30-ish. We are seeing a lot of anxiety. We're seeing a lot of sexual health issues, as well as hypertension and prediabetes. And we've got to turn that around. And so we're having a lot of talks about how we can mold the primary care setting to make it more welcoming and comfortable for our young people, because this is the time. Now's the time for them, that they can reverse this and get on a good track with themselves. And we just want to make sure that we are on the right track. I don't know if you all a lot of times here at Hope Health, we unfortunately refer to ourselves as the stroke capital of the universe in the PD. And I know that's not sexy, and it's not something that we talk about a lot as far as a cause that people really get behind, but we need to make it that. And so especially what we're seeing in our 18 to 30-year-olds, we've got to get these young people in care. So if that is something that you feel passionate about and want to work together on, that's just another example of something that we really want to try to do, especially in our rural communities where access isn't as easy.
You know, I wonder if that's a gap that we as a nonprofit community don't serve those folks as much. You know, we're very good with young kids and you know, the Boys and Girls Clubs and the Big Brothers Big Sisters program. But I'm just, if any of you are working with that, what did we say, 18 to 30? Is that what you're calling young adults?
Ish.
Yeah.
42. I like to say I'm young, but I'm really not.
You know, if any of you are working with that specific demographic, just give us a unmute and let us hear from you, or put it in the chat box. Because if that's a gap, we need to talk about that.
I just wanted to say one funny thing when you say that is we monitor our students from once they go to college, their freshman year to their senior year, we monitor them to get them through college, and then they become official alumni. And it is funny that you say that, because the freshman year, I can tell you, my students gain anywhere between 10 and 15 pounds their freshman year of college.
Everyone does.
Yes.
It's kind of like that after marriage bliss, I guess. They get into and they'll come back and I'm like, wow, you look so different. My cheerleaders and stuff. But anyway, I just wanted to throw that. We just got finished talking to one of my teens about it. She's in her sophomore year and she's like, Miss Carla, I don't know what happened.
It's called drinking.
I know.
Cafeterias with bad food in them.
Exactly.
Yeah. So I'm not seeing anyone saying that they're working with that group. So
And that could be people right out of college. It could also be, we see it with new parents. So a lot of young women of newborns, once they graduate from OBGYN, once they've had their baby, that seems to be it for them. They're so focused on taking care of that child that they lose themselves. And so we're doing some things here to check in on those new moms and new dads, but young adults can look like a lot of different things.
Well, and I see some folks from Reading Partners on, so that may be a great read in terms of the reaching out to young moms, parents. So anyone else have any thoughts or ideas about this group that Tiffany's identified as being a target audience?
Yes,
Hi.
we're here at Food Chair.
Okay.
I'm sorry, this is Bishop Sullivan. We do provide a clinical program on the health awareness on fruits and vegetables and helping the patients get their A1Cs lowered and their HDLs and their cholesterol counts and their lipids. And we do a 3-month monitoring process and seeing how their numbers decrease in order to get them healthier, which decreases heart attacks or strokes. The program was a 6-month grant that we went through the Medical University of South Carolina through Michelle Troop, and provided that assistance through the Food Share program in helping those patients get ultimate health. We're going to continue that program. We're trying to get some funding now for the PD area to do that program in the PD area. I spoke to House Representative Robert Williams, and we're meeting with the pastors and to a ministerial alliance to start it at the churches in Darlington, and to go ahead and start working with them. And they turn that chart information into their doctors, and they monitor them every 3 months. And they'll be a part of the Food Share program where they can pick up their fruits and vegetables. And what we're doing with that, we're going to try to help them with ultimate health, meal planning, and also showing them different cooking tips to help decrease cholesterol counts and also lower A1Cs.
Thank you. Mr. Jackson, Wayne, did you have something you wanted to share?
Well, yes, as a Mercy Medicine Free Clinic, and I'm kind of here, I guess, David and Goliath with HopeHealth, I guess, but I got to speak up here. We feel we serve an integral part of the entire community also, and we certainly partner with HopeHealth, and many of the acuity of our patients, sometimes we have to refer those folks to HopeHealth, but and likewise the flow comes back to us also sometimes for patients that for whatever reason want to be in a totally Christ-based environment and with no charge at all. But just to let you know that the free clinic here in Florence is very much alive and well, and we do support those folks that are 18 to 64 years old, is what you're talking about. We identify those young people who indeed need nutritional services. We have in-house dietitian that counsels them. We also have relationship with mental health providers, PD mental health, also to get those folks in that particular age group mental health services also. So in this whole dynamic here, Mercy Medicine is here to take those, those group of patients that have zero income. We're not sliding scale. We provide free medical, dental, and medication support to those folks from ages 18 to 64 to include that group. So we're here. I think we're part of the community and integrate it and work with Hope Health and the other agencies, Naomi Project, all of them. So we're here. We're very much alive and well also in the community.
Perfect. And as
Thank you.
Tiffany says, there are enough sick people in South Carolina for all of us.
Absolutely. Thanks for all you do, Wayne.
So,
There are plenty of sick people here, so we all have to play a part.
yeah.
Yes, we do. I agree with you.
Belle, did you had your hand up?
Thanks, Madeline. This has been great. I feel like these are all my folks. I've loved hearing all this. Just a thought about connecting with that aid.
Just in
Can you
case
hear me?
Yeah, will you just introduce yourself in case people don't know you? I'm sure they do.
Belle Ziegler, and I represent the Community Foundation, Eastern Carolina Community Foundation, that serves the PD region of South Carolina. So a lot of the counties we've talked about today. I just had a thought about those of us who are in the funding space. I've worked with Carla a little bit on this, but perhaps, I mean, we can't track health data, but perhaps we could pilot something with our scholarship recipients annually, just to kind of give them connections or resources, maybe a directory to healthcare, or at least encourage them to have a relationship with, student healthcare services when they are, in college or at university. There may be something there that we could learn from Francis Marion locally. Just a thought, because I always feel like once we fund a scholarship, we lose touch almost immediately with those students on many levels, and that might be an opportunity.
That sounds like a real opportunity because I know that there's also with Darla Moore, you're doing a new scholarship program too, and that's when you give young adults money, you get their attention at least for a little while. So that could be a good way to try and reach that young adult audience. So those that are receiving the scholarships from you. Excellent. Yeah. What other questions? Go, Val, go on. Did I interrupt you? Oh, you okay? Okay.
No, that was it. Thank you.
Good. What other questions about this partnership that we're hoping, our partnerships that we're hoping to develop, have you got? Well, there have been lots of good ideas shared today, so I'm really eager for that. As I said, we're going to confirm that we're going forward with the January dates and get that out hopefully before Christmas. It may be the first week of January. But if this is work that interests you, please plan on making it to those gatherings so we can go dig deep on how these partnerships work. Several of you have gotten good ideas of things that could make the partnership program work stronger. Liz, I know we talked a little bit about what you do and whether there's a role for your services in the partnership. You shared in the chat box, but do you want to just briefly introduce yourself before we say goodbye?
Sure. Thank you, Madeline.
I invite that as well. We have a little bit of time.
Absolutely. So good morning. It's really lovely to be able to join you all today. My name is Liz Walsh. I'm the South Carolina Network Director with Unite Us. In case you haven't heard of Unite Us before, we are a technology platform that creates coordinated care networks. We're in over 40 states and we're in South Carolina. And I'd love to be able to talk about how we might be able to support these initiatives through this platform. So essentially, it's connecting all community-based organizations, government agencies, healthcare in this single platform where folks can inter-refer. And not only, let's say someone comes in and they need, a food box from FoodShare. Not only could your organization refer out to FoodShare, you would hear the actual outcome of the referral. So was it resolved? Was it unresolved? And based on those outcomes, what was the actual result? Did the person get a food box? Were they enrolled in SNAP? Each of these outcomes is different. And we really need to be tracking those so we can start talking a common language around social determinants of health. So the platform is free for all community-based organizations, federally qualified health centers, churches to utilize. And so if this might support these wonderful partnerships and be that kind of like technology support system, I'd be happy to talk about that because I think we could get some really valuable data out of this to demonstrate the value of these partnerships.
Excellent.
Liz, thank you.
Could she put her information in the chat, please, for us to be able to communicate with? And also the young man who was talking about, he got in touch with Robert Williams. I need his information also.
We'll send, if everyone's okay with it, we will send out the attendee list with the email so y'all can connect. In fact, let me use this as a chance to introduce Alex Taylor. She is part of the Together SC. Jennifer's on too, I see now, and Ben. And Alex is helping Ben with our Zoom call. She's going to be our Zoom Arena Czarina. What did we come up? We had a name anyway.
Yeah, one of those.
You'll be getting a follow-up email from Alex with this information in it. So be sure again to put your contact information in the chat box if you haven't already. And look for an email from us sometime in the next 2 weeks with next steps. Tiffany, anything else you on your team want to share or ask before we say goodbye?
Any thoughts from you ladies?
No, I just have to say thank you for your patience with my nerves. I'm rehearsing in my head the things I wish I had said, but with the content of this conversation, I am so grateful for how everyone else has shared. It's been very informative, so thank you.
You know, if you'd been doing this for the last 2 years, you'd have gotten to the point where, you know, I think I probably would show up with curlers in my hair and in my pajamas. I've gotten so lax about this thing, you know, like, but good for you for caring, because it's a better job when you care.
Yes, absolutely. Sandra, any thoughts from you this morning?
I think we have a lot of good resources out here, and we just need to utilize them.
Yep. Collaboration, connecting. Amy, did you want to say something?
I did. Thank you. I just thought of a question. So just so I'm clear, so the in-person events in Lake City and in Orangeburg, are those geographic in nature? So Healthy Learners definitely has our eye on both of those communities. So are we there thinking about those communities, or is that going to be the same meeting? You're just offering it in two different locations. I guess I'm trying to
do two things, one of which is going to happen in two different locations. It's going to talk about what should this partnership look like? How should we run it? Right? So we can get because there's literally going to be a written agreement that HopeHealth and your organization will sign for the partnership. So we will come in with a draft of that and we will get your feedback on it. That conversation, both of those conversations will inform the final partnership agreement. But then the second part of the meeting is going to talk about the community itself and what's happening around the social determinants of health in that community.
Okay.
So part of it is the same conversation in both places, and part of it will be unique to that geography. So I would like you guys to be at both. Okay.
All right. Thank you so much.
Any other questions about those gatherings?
This question, Madeline, I'm guessing you're going to get in contact with me. Okay.
In fact, Carla, if you can stay on afterwards with Tiffany just to talk about whether we're going to go forward with those January dates or not, that would be fantastic. And Jennifer is asking, as a patient, would that be helpful to hear from someone who's actually been a patient? I think that Joyce, was that the reason you invited Jennifer to be part of the conversation? Joyce, you're on mute. I think you know. Yeah, there you go.
Yes, I sure did. I wanted her to hear what she has in store for her.
Jennifer, please join the conversation. Unless you're there, you go.
Thank you, Miss Madeline, and thank you so much, Miss Joyce, for inviting me. Yeah, I'm just so grateful as a foreigner. You can immediately tell from my accent that I'm not an American. I'm a foreigner, but I live in America, and there's nothing like being made to feel at home when you come to a new place. First of all, when I came to Florence, I was introduced to HopeHealth, and just the name itself was very attractive to me. I thought, yeah, I'm going to get hope and I'm gonna get health. And that happened because they watched me go through cancer and they watched me get recovered, very, very well recovered as we speak right now. And then Miss Joyce took me in, and it's just yesterday that actually Hope Health did more than I have ever known they could do. They made sure I came back home because I was stranded at Hope Health after my treatment. But you should see Hope Health staff running around to make sure that I get back home safely. And I was so very grateful. Miss Joyce is doing a tremendous job to make sure that women and their children are safe, healthy. And she immediately, when I came here, she talked about Hope Health. And I told her I am a patient and I have appointments lined up. And so she's working towards making sure I get all my appointments taken care of. Hope Health and Naomi Project, I cannot thank you enough.
Jennifer, thank you for sharing, and welcome to our country, and welcome to South Carolina. Your need for transportation is not unique. In fact, the neighbor folks are somewhere on this call. If someone's here, but that's one of the programs that's operating in one of our counties that we hope will be able to expand in other counties, because transportation is a critical issue to getting not only the health care you need in rural areas, but also getting to work and the other opportunities in schools. So we know how hard transportation is. And that's something we got to work on together. So thank you for sharing that, Jennifer. Joyce, thank you for suggesting that. Any other closing comments, questions? I don't see any more hands up. So with that, on behalf of Ben and Jennifer and Alex and the whole Together SC team, we will say happy holidays. We'll be working part of next week and then taking the week between Christmas and New Year's off publicly. We may be working behind the scenes, but we will be back January 1 and ready to go full force into 2022 with a terrific summit, with the meetings with Hope Health. We've also just gotten a grant from South State Bank to do some more work in part of this geography. So we're really hoping that not only will we be on Zoom with you, but we will be in person in 2022. So keep doing the great work you're doing. Find the rejuvenation of your passion and your commitment over the holidays. Be proud of the work you've done, and know that we, as Jennifer says, are on your team and here to help you. Have a great day, everyone.